Thank you, dear Warrington, for that kind introduction. Permettez-moi de commencer par souligner que je m'adresse à vous depuis le territoire traditionnel non cédé du peuple algonquin Anishinaabe. Thank you for allowing me to join this great event today virtually. As you know, Canadians are very proud of our public health and universal healthcare system. However, as we also know, the pandemic has brought to light long-standing challenges within our healthcare system that have grown worse in the last 2 years. Not only has the COVID-19 pandemic highlighted challenges with Canada's ability to use data to support the health of Canadians, but the cost of new medical technologies, the greater incidence, and the greater cost of treating chronic and rare diseases, and an aging population all challenge our ability to deliver affordable, quality healthcare. Les 2 dernières années ont été particulièrement difficiles. Nous sommes tous fatigués du stress et de l'incertitude que cette pandémie a généré dans nos vies. And although it is not over yet, we already can and must learn from the pandemic. Based on the lessons learned from the pandemic and mindful of both the damages that it has inflicted on our healthcare system and the long-term challenges, 2 weeks ago, our government outlined a vision for the future of healthcare that included 5 areas of priorities: reduce backlogs and support our healthcare workers, enhance access to family doctors and family services, improve mental health and substance use services, help Canadians age with dignity closer to home. The 5th area is the one I will be discussing with you today in greater details. Use health data and digital health more effectively. More specifically, let me share with you 3 key lessons that I have heard from experts like you since I became Canada's Minister of Health just a little over 5 months ago. The first thing we have learned is that we absolutely need more reliable, timely, and relevant health data to inform decision-making during critical public health events. The pandemic has indeed highlighted challenges with Canada's ability to use data, both in a timely and agile manner, to support the health of Canadians. C'est pourquoi, il y a un peu plus d'1 an, le gouvernement canadien, en collaboration avec les provinces et les territoires, a commencé à élaborer une stratégie pan-canadienne sur les données sur la santé afin d'améliorer la collecte, la diffusion, le partage et l'utilisation de ces données partout au pays. This strategy will assist with Canada's continuing public health response to COVID-19, equip our country to deal more effectively with future public health events, and achieve better health outcomes for Canadians through the better use of data. The Pan-Canadian Health Strategy is built on a person-centric model with the notions of equity, stewardship, and accessibility at its core. I am particularly grateful to Dr. Vivek Goel for taking on the role of chair of the Expert Advisory Group, who is providing advice to governments on the development of this strategy. Second, we have heard that we need to change the way we collectively govern and manage health data in this country. We also need to give Canadians better access to their own health data. There are indeed concerns that our current system is too fragmented, which stems from the outdated notion of having health data custodians who hold and protect data rather than health data stewards who manage data sharing for the public good with proper safeguards. Cette vision est fondamentale pour favoriser la mise en place d'un système de santé moderne et numérisé dans lequel les données sur la santé d'un patient le suivent dans tout le système. In 2022, it's not normal that from one hospital to another, from one city to another, and from one province to another, Canadians are unable to access and consult their own medical records in one consolidated file. Every Canadian should have access to his or her own digital health information. And that is why federal, provincial, and territorial governments are already working to come to an agreement on the technical and data standards required to allow for digital health data to be shared more effectively. Comme l'ont dit le Dr Goel et le groupe consultatif d'experts, nous voulons faire participer le public et les utilisateurs des données sur la santé pour faire en sorte qu'il y ait une compréhension commune, ainsi qu'une culture des données quant à la façon de gérer, d'utiliser, de partager et de protéger les données sur la santé. Lastly, we also know that the pandemic has accelerated the adoption of virtual care and digitization in the health system. Most Canadians want to continue using virtual care in the future. Governments also recognize that access to virtual care is an integral part of our healthcare system moving forward. Advancing virtual care and digital health will also help us increase access to healthcare services, particularly for Canadians living in remote or rural areas. Furthermore, digitizing the healthcare system has a potential to strengthen Canada's economy and create synergies and complementarities with other innovative economic sectors. It can create more opportunity for innovative Canadian firms, provide better and more accessible care, and support our healthcare workers. La numérisation du système de soins de santé a également le potentiel de renforcer l'économie canadienne, de créer davantage de possibilités pour les entreprises canadiennes novatrices, de réaliser plus d'économies et de soutenir nos travailleurs de la santé. And here we are today, discussing the next steps in health system transformation, exciting new technologies and better, more efficient and more equitable ways to manage and deliver services. In your discussions, I invite you to think of how, together, we can help improve healthcare and health policy for everyone. Because ultimately, the measure of our joint success will not be how far we advance technologically, but how well we use health data, digital health, and virtual care to improve health outcomes for every Canadian and strengthen our public health responses. Thank you. I hope you enjoy the rest of the conference. Je vous remercie beaucoup. Je vous souhaite une excellente conférence.